And why is she asking about my son's penis? That might be something that some of you said when I was passing around my survey. I know that this is a very private topic, and I thank all of you for your honesty. What you provided me information-wise was very valuable to my speech. When I was pregnant with my son 15 years ago, the doctor said, "Are you gonna get him circumcised?" And my first response is, what is that? Like, I had no idea what circumcision was, what foreskin was, and she explained to me what it was. She did not feel that it was necessary. Our insurance would not cover it anyway. My ex-husband and I, we immediately knew that was not something that we wanted to do. And when our second son was born 6 years later, we kept him intact as well. Intact being, we did not cut off his foreskin. So, as I became more involved in the attachment parenting world, I became what is known as an intactivist. I've done countless hours of research on this topic over the years, and it is my goal to educate people on the truth about circumcision. So today, I'm here to try to persuade you to take immediate action to abolish routine infant circumcision. We are going to talk about why we need to abolish routine infant circumcision, some of the common misconceptions, as well as why this would be a betterment for humankind. So now that you know some of my personal history, let's begin with why we need to abolish routine infant circumcision. The best way to understand the need for this is to be clear just what it is. Routine infant circumcision is the total or partial removal of the foreskin. Okay. According to an article about how circumcision is performed at birth.com.au, there are three main types of circumcisions. The second type is a Gonco bell and clamp. This has been used for the last 30 years primarily and still remains the most popular method today. How they do this is they push down the foreskin. This is called forcefully retracting the foreskin. It is similar to ripping off one of your fingernails. This is because the foreskin is actually fused to the penis. And then they would put the bell on top of the penis, pull the foreskin back up, pin it into place, and then take a scalpel and remove all of the foreskin. So, the whole procedure takes 10 to 15 minutes. And like any surgery, it has risks. Jerry Kennard, contributor to Men's Health at About.com, listed bleeding and infections the #1 complications. Painful erections and pain on the circumcision site is pretty common. Disfigurements such as curvature of the penis can happen when too much skin is removed from the penis or it is removed unevenly. It's really hard to gauge the loss of sensation since most adult males can't compare it to having a foreskin. But a study was published in BJU International in 2007, and they concluded that the sensitivity of a circumcised male was much less than an intact male. And the most sensitive part of the penis was actually the scar site because all of the nerve endings had been removed with foreskin. We must abolish routine infant circumcision. There's no legitimate medical reason to cut off healthy, functioning skin. We must abolish routine infant circumcision. The risks far outweigh any of the so-called benefits. We must abolish routine infant circumcision. It is a human rights violation. The only person who should be choosing to modify their body is the owner of that body. They do this all the time in other countries, the little girls, and we're outraged, yet it's acceptable for our boys. Now that we know why we need to abolish routine infant circumcision, we need to find the solution to the problem. And to do that, we must understand some of the common misconceptions. Some people believe that being circumcised is cleaner, that the foreskin smells bad, or that it's hard to clean. Well, guess what? Cleaning an intact penis is as easy as wiping off a finger for a baby, or when they're older and they retract, pulling back the foreskin and rinsing it with water while you're in the shower. Some people think that you're more prone to infections. Well, according to sources cited at drmom.org in 2010, 2% of males that were left intact would need antibiotics for UTI, even less if they weren't force retracted. You might have heard stories about adult men who had to get circumcised later. Well, according to the site, Well, only 1% of intact males are told that they should get circumcised, even less so if they weren't forced retracted. So some people think that, removing the foreskin is an easy procedure with minimal risks. 10% of circumcised babies will require corrective surgery. 2% will need antibiotics for infections, and 2% will have adverse reactions such as seizure, heart attack, stroke, loss of penis, and death. Loss of blood and infection being the #1 cause of death. Now, some people might say, well, what if my son's mad at me that I didn't get him circumcised? Well, what if he's mad at you if you did? You can always remove foreskin. You could never put it back. Contraptions like the TLC tugger were made to stretch out the penile skin to simulate foreskin. Now, while this restorative process does have some benefits, you will never get back the nerve endings or the ridge band. They're forever gone. The TLC tugger site boasts that over 200,000 men have started this 2 to 3 year restorative process. That is 200,000 men willing to take such drastic extremes to just get some kind of form of foreskin back. Dr. Darcia Navarez wrote an article, Myths About Circumcision You Likely to Believe, in Psychology Today. She states that babies do not sleep through circumcision, as some people claim. This is merely a response to extreme distress and pain. 25% of doctors don't even use anesthesia. I should specify OBs that do this. And that the pain from a circumcision can cause rewiring of the brain, which could make them more sensitive to pain later in life. You may have heard that getting circumcised would prevent STDs. This is just faulty. The only way to prevent an STD is abstinence or safe sex. Most men who've had an STD are circumcised. The bottom line is, we just need to know the truth, not the propaganda that the medical establishment and the media are pushing on us. People being educated about the fallacy of circumcision is the solution. People standing up for the rights of babies and men is the solution. Now that we know how we could find this solution, let's talk about how this will be a betterment for humankind. Abolishing routine infant circumcision will be a betterment for humankind. Now, imagine that you took your baby in to be circumcised, and they died. Just imagine the horrific guilt that you would feel knowing that your decision led to your baby's death. That's how 117 sets of parents feel every year. According to Dan Bollinger's book, he's the author of Lost Boys, an estimate of U.S. circumcision-related infant deaths, written in 2010. Now imagine that these deaths didn't happen, that these innocent children didn't have to die, that they got to grow up and celebrate their first birthday. They got to learn to ride their first bike, enjoy the first day of school. Imagine that the parents never had to go through the anguish kissing their baby one last time before putting them in the ground. Routine infant circumcision is an unnecessary act that hurts babies. We have to make it stop. We have to abolish routine infant circumcision. If we do not stop this, these senseless deaths will continue. Now, I've discussed why we need to abolish routine infant circumcision, understanding some of the common misconceptions, and why this would be a betterment for humankind. We need to abolish routine infant circumcision because it is wrong to remove healthy skin without just cause. It is wrong to alter somebody's body without their consent. And the adverse reactions are just too risky. To find a solution, we must educate why routine infant circumcision is wrong. The world will be a better place for babies, men, women, and parents if foreskin is left intact. Babies will no longer need to suffer needlessly. Men will have the freedom of choice. Women and men will enjoy better sex. And parents will no longer have to make this difficult choice. Immediate action needs to take place. And that starts with you telling everyone what you heard today. If you could just change one mind, you might save a baby's life. They might change some minds. I implore you to write to our congressperson to tell them that we need to stop routine infant circumcision. Right now, we're on the right path. The circumcision rate used to be 80% just 30 years ago, and is now 55% nationally average today. With so much misleading information, it's very confusing to make this choice as a parent. Let's leave this a choice for men. This will lead to a better future for everyone.